Hello there. So it's Wednesday and today I'm sharing with you my favorite in-office treatment. This is called, well, we've called it the trifecta. It begins with the Dermaplane, which I'm going to do here in a moment on my client. We are going to move into the Ipl room and do an IPL, and we're going to finish off with a PCA chemical peel. This is highly effective if your skin just has not had any love for quite some time and you need a quick fix. It takes about an hour to do the whole procedure, and it is exceptional. So there aren't very many contraindications unless you have super active acne. Sometimes a dermaplane is not the best thing, in which case I would do a microderm first. However, following that up with an IPL treatment and then a chemical peel is going to be super helpful. So I'm going to throw my gloves on. I'm going to get going. A lot of this is going to be sped up. If you have any questions at all, comment below the video. Comment with comments, like it if you like it, and share it if you would like to share the love. Now I'm just starting with a gentle cleanser, and the steam feels so nice. So I like to steam most of my patients unless for any reason they don't like that. If your client needs any waxing done, you're going to do that after your dermaplane, and really any extractions, because once we leave this room we won't be coming back. So you want to make sure all of that is handled beforehand. Now I'm prepping her with some alcohol. The protocol for dermaplane is actually acetone, but and the whole reason this is even used in a dermaplane procedure is to completely degrease the skin. And the reason you want to degrease the skin is so that you don't allow the blade to catch at any point at any time. So I use a fan so that they're not completely inhaling it, but you don't have to. I just find it a little bit more comfortable if you're the patient on the table. So now for the dermaplane portion. I always wear a mask. I've just gotten used to it over the years. You certainly do not have to. I cover the patient's eyes because we do use a very bright surgery light, which I'm going to turn on. So this way I can't miss any hair. Dermaplane is meant for exfoliation, but it does take away the vellus hair. So a lot of people really love that it takes away the hair. And so it's been very popular more recently. You notice your makeup goes on really smooth, and like I said, your skin is gonna have that healthy glow. So I'm gonna begin up here. Just a little reminder, if you're going to reach up, let me know, and I'll step back. Okay. On the upper lip or the dermaplane, depending on the patient's preference. Just FYI, if you have really coarse, thick, dark hair, have it waxed instead of dermaplaned. It's going to keep the hair gone longer, and it's just gonna, it's going to be a smoother, less irritating procedure to have wax versus dermaplane, because you know this is a blade, and if you have really coarse hair, it's just a little uncomfortable. So I do give them that option, but you know what kind of hair you have, so you know what to ask for. Okay, right back in the center for a moment, and then press your lips together like you're hugging them. Okay, so that completes the dermaplane portion. Now we can't dermaplane the nose because the area isn't totally smooth and flat. We use a microdermabrasion machine for that, or if somebody's skin is super red or they deal with rosacea, we don't go over that area. A lot of times we'll use a chemical peel to just exfoliate. So she does not have rosacea. She does have some redness on her skin, and we're going to treat that next, but this is the microderm. So I'm just gonna go over her nose. Okay, so next up are extractions. So there are different ways to do extractions. I like to use my hands because manipulating the skin is something that I'm super comfortable with. I think some of the girls who work here love using the actual extractors. I think it's really just comes down to your technician and whatever they're most comfortable with, that's what you want them to do. So that's what we're doing next. Just a little tip, blackheads that fall on the nose and on the chin are areas that most people are prone to getting little blackheads. You can extract them, but don't obsess about them. The reason I say that is because the moment you are able to extract them, in the next moment, you know, they fill right back up. So just roll your skin, don't push too hard, because if you do, then you compromise your skin. And what happens is you can break blood vessels, you can destroy tissue if you get too aggressive. So it's not worth it, is what I'm telling you. You know, the reason I don't need steam right now is because I just did an exfoliation that took off the whole layer of dead skin. So these pores just roll right out. It's very, it's actually very easy, because a lot of people do ask that question. Okay, done with extractions. Next up, we're going to clean up her brows. Now, I will say that because I work in a derm office, a lot of patients use topicals that are prescription strength. So I always use a specific cream on the skin just to be sure that I'm not going to pull skin and that this is only going to adhere to the hair. One other tip, if you're an esthetician, something that I've learned along the way is we don't double dip our spatulas, and when you don't have to have your wax set as high. Your melting point doesn't have to be set as high And because of that, it's a little more gentle on the skin. So just FYI. Okay, she has a little barrier cream. I'm gonna trim them up and then we're going to wax. Now she's growing in her eyebrows so that they start at her tear duct, and that's where you want them to start, or even closer together. And you know, that's up to you. But ideally, you don't want them to start, away from each other. So I'm just trimming the ones that are kind of growing in, so they're not too wild. But that way, she can continue to grow them in, and her brows will still be manicured. Growing in your brows, as you know, if you've done it. Takes a lot of discipline, so every day you'll look at them and want to do something about it, but hang in there, it gets better and then you won't regret it. Okay, we're done in here. So what I'm gonna do is just put on some antibacterial cream over the area that I just waxed. And then we're going to move to the IPL room. If you have any questions, like I said, comment below the video. I will tell you, if you're an esthetician and you're watching this, I know in school they told us, you don't wax after you've done an exfoliation, and you would never combine treatments, but through the years we have found that that's actually one of the most effective ways to do treatments. It's just timing and finding the time to do so. So I'm gonna lower my patient down. I'm gonna take a hold of this camera and take you over to our IPL room. Follow me. Do you see what this says? This is my favorite room. Okay. You're good. Okay, let's get her comfortable. Lean back and put this bolster where it is good for you. All right, a couple of things. I'm going to close the door. All right, you guys, so now onto the IPL portion, and we're going to finish this off with the peel. Now, this is a patient who's done IPL multiple times. She's done a series of 5 already, and this is technically a maintenance treatment. So I have the machine set just to really help diffuse some of the redness in the skin, to help promote collagen production. Naturally, it does that. The machine does do that, but it will make the pores appear tighter. And ultimately, IPL just kills bacteria. It's one of the best treatments available in this industry. So just keep that in mind, especially if you find somebody who's been working with the machine for a long time. So I'm a huge, huge fan. You're gonna see this sped up, but again, questions on IPL, comment below. There's a whole video on IPL. It's about 2 minutes long. Check that out if you are interested in just that treatment, because it's pretty exceptional. Okay. I like these goggles because they're meant for laser and IPL. It specifically actually does say that, and I can get around the eye a little bit more thoroughly, so I'm a huge fan of these little sticky eye goggles, if you will. Now I'm gonna set the machine and we're gonna get going. Okay, this is Sonogram Gel. It works as a conductor for the light. and it's a barrier for her skin because the machine emits a lot of heat. So this feels really good on your patients. Okay, I'm gonna have you tilt to the side. Starting on this cheek, it's gonna feel cold, but it is the room temp gel. So it looks perfect, textbook perfect. I mean, her skin is bright pink on this side, and when I do that side, hopefully I can get the camera closer so you can see it also. So you can see her skin is flushed where we've done the IPL, but because it's a maintenance treatment, we're not trying to make it look insane. In fact, the purpose of the trifecta treatment is to just make your skin look amazing. I mean, truly. Because with Dermaplane, you're getting the exfoliation. With IPL, you're actually treating the skin, so you're going to have more even skin tone. And then with the chemical peel, it's going to tighten the pores, kill bacteria, so if you're dealing with any skin issues or problems, it's going to handle it. IPL kills bacteria, so if you have those painful blemishes, you'll notice that they start retracting after a treatment. And also, overall, just layering the treatments we have found, it's as though they all work together and give you better results. You can space these 3 to 4 weeks apart. I think it's a little bit of a luxury to be able to do this even once a year. So finding the time to do it, you do need to be out of the sun 2 weeks before treatment and 2 weeks after. I know that feels a little cold and I'm sorry. Okay. So next I'm going to do her forehead. We'll switch crystals, do the upper lip, the nose, and she's done with this portion. All right, so I'm gonna go ahead and finish up. On the nose, I always kick it up a little bit. The nose can tolerate more. It is just cartilage, and you get those little broken blood vessels around your nose. The IPL will diffuse that a lot for a while. They do come back, but it's really nice to just see that nice clear complexion. I'm gonna get the camera really close because I want you to see this. I never know where to look in these videos, by the way. I'm new at this, so work with me here. But I do want to get the word out and I want to share with you, so that's what I'm doing here. Okay, so I'm gonna show you just a tiny little bitty broken blood vessel on her skin, and I want to show you how this clears it. It's pretty impressive. So right next to the nose, you can just see there's like a tiny little red mark. I'm gonna pull this away, zap it, and then bring it back. And we're done, but I want to show you the difference. Okay, so as I bring it close, you can see that it's gone. We actually have collapsed the blood vessel. It'll just go right back into the bloodstream. It's superficial, so it's not supplying blood to anything important. It's just something that happens from overexposure to sun exposure over time and trauma to the skin. So trauma could even be blowing your nose excessively. So that's why with the nose corners, it does come back really fast. I'm gonna get her cleaned up and we're gonna move on to the peel. Let's get you back in that frame. There we go. So IPL stands for Intense Pulse Light. It's a broad spectrum light that we've just used to collapse blood vessels, to promote collagen production. If she had pigment issues, we've already cleared those actually, and she didn't have much to begin with, but if she had any brown spots, it would target them. However, the only tiny ones she has left are so close to the color of her skin that the machine actually will not see it. So it's not a matter of what we see. As you just noticed, we cover the entire area. Okay, so last but certainly not least, the chemical peel. I do like to put a little eye cream around my client's eyes. Chemical peels, just like retinol, they migrate, and that's why you stay away from the orbital bone and around the eyes. It's also why we moisturize, just to kind of protect the area. Next, I'm going to put a little bit of, I don't have my moisturizer for her lips, so I'll do that after we shoot. But next up is the peel. Okay, and this is a PCA peel I'm using. It's just one that's nice and appropriate for her skin. I'm not using boosters. I'm keeping it very simple because actually I don't want her to have excessive flaking and peeling. I'm gonna go ahead and start applying it, okay? I'm just gonna do one layer to give her skin. I mean, it's like that finishing touch to polish off the skin. It does sting because we've just dermaplaned, and you can use a fan to help with this. So we're just doing one layer. I'm gonna get a little more to keep her cheeks balanced. Now you're noticing her skin is flaring. It's getting red, it's getting mad, and that's normal. It will tone right back down. It's going to be neutralized before she walks out the door. We're just gonna let this soak in for a moment. And while it's soaking in, I'm gonna remind you, so post-treatment after a treatment like this is no working out for 24 to 48 hours, no hot tub steam rooms or saunas, and lastly, you don't wanna go in the sun for an extensive period of time for 2 weeks. We have activated your melanocytes at this point using the machine, and you just wanna be really aware of that. You can wear a hat, you can walk your dog with sunscreen and a hat, but just excessive sun exposure, no tanning beds. I mean, I hope you're not tanning in a bed anyway, but nothing like that. So that's it for the peel. I'm gonna neutralize it, put SPF on, and she's done. All right, so thank you for watching. It really makes my day when I get comments and you guys subscribe and like and all these things. I'll keep rolling these out if you like what's coming to you. And if you do, subscribe to my channel.